Hello, everyone. I hope you can join me tonight. Dr. Gallus will be on momentarily, and we're going to be talking about liposuction, which I love. Not only do I do a lot of liposuction, but I've had liposuction, so I can talk about it from both sides. All right. There is Dr. Gallus. Let me pull her on. Trying to pull her on. There we go. Hey.
Connecting. Mine's just connecting. So hopefully I can see you in a second. Oh, there I am. Cool.
Hi.
Hi. How's it going?
Oh, living the dream. Got the kids in bed. So if we hear the pitter patter of little feet followed by screaming and barking, it's cool.
Oh, okay. Yeah. My kids are not in bed because it's 5:30, but I have the weird emoji pillow behind me. So that's nice.
That's nice. I had to, if you look further just off screen, there's a giant stack of Transformers that I just shoved over and replaced with a plant. So it looks very zen and professional.
Yeah. So that's cool. Yeah, I always forget you're so much farther ahead of me in time, but
yeah, 3 hours. I know all those meetings where you and Dr. Horton are like still at work. I'm like, I might be in pajamas from the waist down. It's entirely possible.
Yeah. No, I get that. Yeah. And then for ASPS, for a national society, oftentimes they're like, can you do it at 3? And I'm like, no, I know it's 6 for you guys, but I really can't have any.
Like middle of your day. Yeah.
Yeah. And the couple times I've tried it, it's been a mess. So
yeah, there's still stuff happening. I don't know how your office is, but I'm literally asked a question every Friday. Yeah.
Yeah, totally.
And then they come in, they're like, oh, you're on video. Backpedal.
I know. So this is what they ask.
Or they text you and you're like, I can't text you back. I'm literally on my phone. It's good to be needed, though. I'm glad.
Yeah, it keeps me off the streets, I always say.
Yeah.
So we were going to talk about liposuction this week, which I think is a great topic.
I love liposuction. It is, okay, it's one of those procedures that it's kind of like going to the gym. During the surgery, it's maybe not as fun as other things because it's just a lot of physical labor, but the end result is so worth it.
That's true. I've never heard it described that way. Yeah, I should start explaining it like that because I do think one of the common, not complaints, but one of the common things people discover after liposuction surgery in the first couple of days are like, that really hurts, or it's a little painful.
Did all of
it is surgery. So I try to warn people, but a lot of times they add it on to a different procedure and they think, oh, it's just liposuction. I'm like, no, you might actually, find that's more uncomfortable than the breast surgery or something else.
Oh yeah. I do lipo on all my breast reductions, and that is hands down always the most sore spot where I lipo.
Oh yeah, right on the side.
So, hi Cleveland downtown. We're being followed by one of the Cleveland accounts tonight. Thanks for watching.
Oh, cool. Yes.
Yeah, although I have to be totally straight up about post-op pain, and everybody's different. Everybody experiences different pain. I had lipo between kids 2 and 3. So when was that? Like 2016, 2017. And I had it on a Monday, and I was back in the OR doing lipo on Thursday. It was not. And that's literally the only surgery I've had. But I think I took one Norco that night to sleep, and then I took Motrin, and I was like, this is cool. It was not.
I know. I try not to use, I haven't had it, but I try not to use myself as a barometer because I have a very high pain tolerance and tend not to give myself a break. But our office coordinator had it done, and she had it, I think, on a Friday and came back to work on a Monday.
Yeah, but it depends. Although the other thing I've noticed with my patients is that the more fat I remove, the more sore they are. So I always reassure them. I'm like, that's good. I took a lot of fat. That's why it's okay.
So you're saying my patient from today, who I removed 5 liters of, is going to be a little sore.
Well, she might be a little more sore than somebody who got
than someone who's just right here. So I do it's a misconception, but liposuction is not a weight loss operation. So I think some people confuse that.
It is totally contouring and spot reduction.
Yes, that is true. So I was contouring today, and then was grafting the fat back in, so you can put it in the butt or the face, right? Or face. So today I was doing a BBL Brazilian butt lift. So transferring it to the butt area. But it's, you know, it's an effective procedure for that. And it's also very, I think, effective for breast enhancement if you're not looking for like that kind of upper pole.
Right.
Look.
I actually have one coming up where we're just doing it for symmetry. So it's nice to have a little bit of volume, but I always warn patients, it's gradual. And if you're really going for a large size increase, it's not going to happen all at once.
No, you can get maybe a half to a cup size at one time. Do you use a specific technique? I do safe lipo. I don't know.
Yes, I also do. You know, it's interesting because, I mean, do you use a power hand piece? I know a lot of people do safe lipo. Yeah. So I got onto safe lipo, which stands for separation, aspiration, fat equalization. There we go. I remembered. And so our power hand piece broke for a while. And so I'm like, wait, I remember people were doing safe lipo and we had a basket cannula. So a basket cannula, it looks like a little basket and you'd use it off suction to break up the fat. And by doing that, it was okay without power. So, you know, I've done that occasionally, that's where the muscles come from. It's the lipo.
That's right.
But yeah, I also do safe lipo. I use a power hand piece, which basically oscillates back and forth for you guys who don't know what power assisted lipo is. And it just makes our lives much easier.
Right. And so I do to mess with the little basket cannula on power and then do the liposuction, which is again kind of standard, you know, sucking fat. There's no other way to do it.
Yep.
And then do the equalization part, which I've seen Simeon Wall, who created safe liposuction or patented the name and the technique. He's doing a lot of it around breast now, and he will do it off power around the inframammary crease. So kind of hybrid.
Yeah. Is that to like elevate the crease, like the Holly-on technique?
Yeah. So he calls it BBL.
I love using the basket to redistribute fat. I had a patient 2 weeks ago who just had an indented scar, and just leaving a little fat around it and then using the basket cannula, you can just redistribute and smooth out. It's such a nice technique.
Yeah, I find it's very effective, and I like doing it that way. And I prefer the power for small areas that I do in office. You don't really need power, so I'll do like under the neck or something like that without the power assist. But yeah, I didn't realize a few years ago I did it without power, and I was like, wow, this is hard.
I always tell people it's like driving a car without power steering,
which is hard.
Do it, but yeah, it's hard. It is. Yeah. Now, do you do awake lipo? Because you mentioned office.
Yeah, so I will do awake lipo. I tell people that so I've created some rules, and I know you have a lot of experience with awake lipo, and we have a colleague.
Fun fact, I used to work at Sonobello, and all they do is awake lipo. So that's why I liked it.
So I try to limit it to one area because that's kind of what I can tolerate and the patient can tolerate.
Right.
I adjust the fluid, the lidocaine in the fluid to try and give them more relaxation. I don't know, what were I know some things that Dr. Gruber in Tampa recommends, but if you've ever heard her talk, or any of the people who talk about like awake facelifts or any of those things, they have the most soothing voices. And I think 50% of what they do is their like demeanor, like they're very zen-y. You know?
Well, and I have to say, I loved Sonobello because I got really good at awake lipo, and I had it there by one of my colleagues when I worked there. And it was, honestly, I looked forward to the volume and the nap, and it was everything I hoped for. But the key is really just expectations, going slow. I actually do like awake lipo because I can have my patient roll and position themselves, which is really nice. And I don't sedate people very heavily. I will do like just a little bit of Versed and a little bit of fentanyl, and like they're awake and talking. It's not
right.
Not out at all. The key is higher concentration of lidocaine, which is the numbing medicine, infusing it slowly. If you can warm it up, that's nice. And I'll limit it really by how much lidocaine I can use. Obviously, I don't want to max out on that. So I'll do a couple areas awake, but it's always patient preference. If they would rather be under anesthesia, that's totally fine, and that is what we will do.
Yeah, it just, like I said, it takes a little longer because you have to be careful, and you know, you can't go as quickly.
Right.
And then I've had a few people that are not, like just around the belly button area are really sensitive.
Yes,
And
that
there's a
is a
lot of
spot
nerves
that can
there.
burn.
Yeah,
So
so that
it's
can
one
be
of those,
hard.
like, a couple deep breaths will be done in a sec.
Right, right. Yeah. So do you use any adjuncts to liposuction? Any other technology?
You know, at Sonobello, we use, what was it, the Cynosure, the laser lipo for skin
Mm,
tightening. I wasn't overwhelmingly impressed with that. One of my colleagues uses Vaser, and he actually wrote one
mhm.
of the papers on Vaser. And, you know, he thinks it gives good skin tightening. It breaks up, basically Vaser's ultrasound assisted lipo, and the ultrasonic
Right.
energy breaks up the fat. So instead of using a power oscillating handpiece to mechanically do it, you're using ultrasound energy, and you do get like a modest skin tightening effect. I would like to check out Renuvion. I know Dr. Gruber uses Renuvion, and I've seen some amazing results. And that is J plasma, right? It's like a plasma
Mhm.
beam. All of
Yeah.
these skin tightening effects, by the way, here's your little physiology lesson. They work by heating the skin, and that stimulates collagen formation, and that's where you get the tightening.
Right.
So I don't actually use anything, and I get very nice skin retraction. How about
Well,
you?
I think the safe lipo technique does give you some skin retraction because that extra vibration, that equalization, that trauma, I think in its own right stimulates some skin retraction. Just the
Mm-hmm.
trauma of doing liposuction does that. And I think that additional moving things around really helps. One of the offices I operate out of has Vaser. I too am not super impressed with the amount of skin tightening you can get, but I'll use it because it helps kind of melt the fat. So you can use it at the beginning. And so
Yeah.
if it's a man or if it's stubborn fat along the posterior flanks, those areas that fat can be a little bit fibrous, and I feel
Hard
like
to get
I'll
out.
just do a little bit with the Vaser and it melts it, and then because it doesn't suck anything,
Right.
and then go through and do safe lipo. And I do have the Renuvion. I acquired it last summer, and I do really like it. I think it's good for patients who are older. If you're 35 or younger and we're going to do liposuction, you know, how much more skin tightening are you going to get in
Right.
general? I've used it in people if you have stretch marks or maybe some rapid weight changes or something like that, and you just need a little extra oomph. And I like both safe lipo and Renuvion, sometimes for revision liposuction. So when someone's had liposuction elsewhere and they have some issues, you can get a little bit more skin tightening, and then that combined with that equalization, try to smooth everything out.
That
So
helps. Now,
yeah, and I like the J plasma.
what about BMI? Do you have a BMI cutoff? Because this is a question I hear a lot. We're in the Midwest, and I think our population is probably a little bit higher BMI than West Coast. I don't know.
Probably.
Yeah, probably.
Yeah.
That was interestingly one of the first comments or questions they asked me at my Sonobello interview was like, "How do you feel about higher BMIs?" Because they will do like up to 45, I think, BMI.
That's pretty big for
Mm-hmm.
liposuction.
Yeah, it is. And you know what I learned is actually on the right candidate, you can get a really impressive result. The thing there, it's nice they're not under general anesthesia. They're very awake, so you don't have
Mhm.
those increased risks of general anesthesia. And in some people who just have like really disproportionate deposition of
Mhm.
fat in some places, I've gotten some really nice improvements. So, you know, that was one of those things where I not only learned awake lipo, and I'm like, this is a great technique, but I don't have a hard and fast BMI. Oh, BMI is body mass index. Thank you, Alicia Rose. And it's kind of a good estimator of body weight overall in like
Yeah.
body composition proportion of fat. So I will definitely do higher BMI patients if what they're looking for is like, oh, I have this spot on my outer thigh that's just like a saddlebag and it's disproportionate. Yeah, we can smooth the contour. It's not going to make your whole leg thinner. That's
Right. Right. So body mass index, I agree, can be it's funny, it's a useful tool, but it's not the end all be all,
no.
right? So the one place you can bump up against it is a breast reduction. If you have an insurance breast reduction, if your BMI is too high, well, maybe they can't work out because their breasts are proportionally too large. And so the same thing, you can have a high BMI and not be a candidate for liposuction because all your fat is intra-abdominal, so on
Right.
your organs, on, you know, inside your abdomen, and have I mean, guys tend to put it on there, have very little subcutaneous fat to liposuction.
Yeah. I mean, that's those hard beer bellies that you see.
Mm-hmm.
And the reason it's hard, you're feeling the abdominal muscles, all the fat's behind it.
Right.
That
So that's,
that fat you can pinch, that's what we can get.
right. So that's not a good candidate. And so BMI is just an indicator. I think it's defined as over 30 is obese, right?
Yes.
Over 20, yeah, is obese.
25
Over
to
25
30
is
is overweight.
right.
I know a lot of people have cutoffs of like around 30 for tummy tuck, 30 definitely for cool sculpting because it just doesn't work on the thicker fat layers. But I've done lipo anywhere like 35 to 40 in my private practice, and even tummy tuck on some BMI patients where it's just a lot of skin laxity and not a lot of abdominal fat. And it can make a really nice improvement.
Yeah, I think it can be a big difference in the right patient. So you just have to, have to choose wisely. That's the judgment part. So, you know, and not everybody needs the same procedure or the same, you know, kind of tool. That's why you have to have more than one tool in your tool set. So I do think that's important. And then I'm sure Ohio probably has a cutoff, but 5 liters is a cutoff in California for the amount of fat you can,
Yeah, in Ohio, it's 4.5 liters for ambulatory surgery centers, but I never did get clarification on whether it's 4.5 liters of aspirin or 4.5 liters of fat.
I know. I think nobody knows.
Nobody knows, and it's like, it's not like you fill out your operative note and like this red flag goes off in some big database somewhere. Right. But the reason there is a cutoff is because you can get big fluid shifts where your body is moving fluids around like crazy, and you can end up even getting like pulmonary edema where you get fluid on your lungs and have breathing problems. And that's why they have these cutoffs for safety. By the way, people, 4.5 liters of fat is a lot in a liposuction session. Like, you're doing a lot of body areas where there's a lot of fat. So it's not a number we hit too often. I think I've hit it like 2 or 3 times in 10 years.
Yeah. I did today, but I don't do it very often. Yes.
Yeah,
but
it's one of those things where you're like, I got to plan for this. We got to break it up into areas and hope I'm not surprised.
Yeah. And 1 to 2 liters, I think, is probably pretty average, but a little bit depends on how much fluid you're putting in, because people do different amounts of fluid to different amounts of fat that they're sucking out. And and then making sure that you have, you know, an anesthesiologist who knows what they're doing in terms of fluid shifts and monitoring fluids and just being careful. And you're right. I think over 5 liters, the safety recommendation is that you stay in a hospital overnight to monitor for monitoring. So I don't know that it's an absolute cutoff, but I mean, who wants to be admitted to the hospital overnight? Or at least most settings aren't excited about doing that just to do an extra liter or 2 of liposuction. It is definitely a good idea to break that into pieces, I think. Yeah. So
absolutely. But it's a fun procedure. And the crazy thing is you can lipo a lot of areas. I mean, upper back on some people. Oh, do you ever use the fat for breast augmentation, the same procedure? Yeah, Alicia, we were actually talking about this at the beginning of the procedure. You can fat graft to the breast and the fat will stay and be alive and gain weight and lose weight like the rest of your body. So definitely one of the techniques in our armamentarium.
Yeah, one of the offices I operate out of often is like, are you going to throw that away every time? Like, if I do
I can't use it on someone else unless they're identical twins.
Yes, you can't use it on someone else, but they're always appalled when I'm like not putting it back in somewhere. Sometimes people just want that removed. Like, they don't need to put it back anywhere.
Yeah, that's more common. Like, we don't have a lot of, and you're welcome, Alicia, happy to answer those questions. And hi, Dr. Ponsky is on. She's another Cleveland woman, plastic surgeon. She does facial surgery. So it's nice to see her on here. Yeah, it's amazing the number of areas you can liposuction. I mean, you can do like ankles, inner thighs, knees, arms. It's kind of fun, honestly.
Yeah, you can really get that contouring. And yes, you can fat transfer to the breast or to other areas like we talked about. There can be a little bit of discussion about the best way to do that. I think I would say the industry standard now is to use, you know, a larger rather than a smaller cannula to harvest the fat, because you don't want to damage the cells. Yep. And I prefer to do it using a closed system so that you're not just, you know, using an open system to collect the fat. And then I feel like the common question patients ask me about fat transfer is if I gain or lose weight afterwards, what happens? And I think that's 100%, that's a valid question, because you have a finite number of fat cells, and when you gain or lose weight, your fat cells are just getting larger or smaller. And so if I take those fat cells away, you can still gain weight in that area because the remaining fat cells will get larger or smaller, but there just won't be as many of them. And if I transfer them somewhere else, those fat cells that do survive as a graft, when you gain weight, those fat cells will get larger or smaller depending on your weight. So I just recently had somebody who had a baby and was inquiring about doing a Brazilian butt lift, so fat transfer to the butt, because she had the baby weight. But if you're planning to lose the baby weight, then you're just going to transfer it to your booty and then lose the weight.
Well, and also like stay proportional. You know, when those really big Kardashian booties were, I guess they are still in style. But like, imagine that after 3 kids, age 45, when you get the middle-age spread, and it's going to look dramatically different.
Right. And it's going to be a little bit hard to undo. We were talking about tattoos in the OR today. And I was saying that I almost got a tattoo on my upper thigh. Somebody in the OR had a tattoo of a dragon. And I was like, oh, I was considering getting a dragon tattoo. Glad I didn't. And upper thigh, what a nightmare. Like, that's not going to age well, at least in my sun-damaged skin. So I was like, phew. But yes, thinking things that won't age well, I'm guessing the Brazilian butt lift is going to.
I know. I'm kind of
really overdone. Like,
if we get a lot of requests for butt liposuction in 20 years, I don't know. And that's not an area I've ever liposuctioned. I know some people do. I know we've had discussions about this before.
It's tough.
There's a lot of really fibrous connective tissue between the skin and the gluteal muscles because you don't want your skin sliding around when you sit down. And if you disrupt that too much, you can get sag.
Right. So, yeah. That is a tough area. And if you, a lot of people come in complaining of those little banana rolls right underneath the thigh, and you just have to be, careful there, because you can take out what's basically stabilizing your
and then get
gluteal fold. Yeah. And you end up with more sagging. Yeah. So yeah, it's just sort of respecting anatomy, as always, is important.
Leaving those important attachments where they're attached so things don't start sliding around in weird ways. But
yeah. How about high definition liposuction? Because I don't do that, but I know that's.
I don't either. Like, as close as I'll get to like the liposculpture, and here we're talking about like recreating anatomical landmarks, like ab etching kind of things, where you're using the fat to kind of change the way things look. That's another area I'm always hesitant, because again, like in 10 years and 20 pounds, what is that going to look like? Is it going to look like you have a little 6-pack of muffins or like doughy rolls on your abs? I will take a little bit more fat out just in the midline above the belly button on women, because that looks very anatomic. But not, yeah, I think high definition. Oh, Alicia's coming up with all the good questions. Does liposuction? And you know what? Cellulite is a whole other thing. And I always tell patients, cellulite is physiologic. It's like upholstery. You know how you have the little tufts? You have connective tissue holding your skin to the underlying muscle, and the fat kind of fluffs up around it. Like my 2-year-old has cellulite. So liposuction usually, it doesn't necessarily change it. It can make it worse. It can make it better. But treating the cellulite is actually treating those fibrous connections. And there's a new medication on the market, Quo, that is injectable. I'm talking to their rep Friday.
Oh, yeah. I have not met with the rep yet, but I'm excited to hear if that's going to be a thing or not. Because, I mean,
all the little collagen bands, and then it's like the dent. Supposedly, we'll see.
Yeah, so we'll see. There's been a few other, there was Selfina. I never used that, but I heard that was so it just snipped the fibrous bands, right? I don't have any experience with it.
I didn't do it either, but it seemed very, what's the word, tedious. Like you're literally popping each little dimple of cellulite out.
Right. And then you're hoping for, I don't know, sometimes when you see the before and afters that, the industry is showing you, you're like,
how much did they change the angle of the lighting?
Right. And that's your best
result.
Yeah. If they're not all home runs. So I know people have been a little bit disappointed in that. And so looking for a solution to cellulite has been, if we could figure that out,
that and stretch marks, we would
Oh,
be
right.
on par with Jeff Bezos. We would be billionaires on an island. So if you guys have any ideas, call us.
Yes, please DM us if you know how to fix stretch marks. So stretch marks, I always explain it to the patient, it's your dermis separating. So, right, a break in your dermis, but the epidermis, the overlying layer of skin, doesn't break or cut. So it's a cut kind of underneath in the dermis.
Yeah.
And so that's just, there's no way to get the dermis back together. I guess you could excise it, but that's never a good, that's
Well, yeah, then you just end up with a million little scars. But you can see it. Like when you cut through skin with stretch marks, there's all these little thinned layers where the dermis tore. It's pretty impressive.
Yeah,
well,
so that's very hard.
It is like edging on.
Oh, yeah.
I'm going to turn into a pumpkin.
What should we talk about next time then?
What do you guys want to hear about? Do you guys have any favorite topics? I mean, breast augmentation in general is always good, or lifts, or, I mean, we both do a lot of breast and body. We've covered some injectables. What do you want to talk about?
We could either talk about tummy tucks, unless somebody else has another.
I like
tummy tucks or breast lift.
Yeah, and you're hosting next time. We'll have it next time instead of Cleveland.
Yes, sure.
Cool.
Breast implant removal. Okay. Yeah, we can talk about that.
Absolutely. We probably won't touch on capsulectomy and things because we talked about that a little bit, but we'll talk about it just in terms of when it's needed. Yeah, for sure.
All right. I think we can do that then. All right. See you in a couple weeks.
All right. You guys have a great night. And if you want to look for the replay, it'll be up on IGTV. And then I always put it on, pre-op clearance needed. Oh, yeah. When it's needed, we can always talk about that too. But we've got all these. Also, shoot us DMs if you have other ideas. And then I post all of these videos to my YouTube channel. It's under Greer Plastic Surgery. So you can find all
that's a good idea.
And watch it forever in infamy.
Yay. All our information. All right.
All right.
Good night, everybody. Thanks for having me.
Bye. Good to see you.
Bye.